Cushing syndrome is a very common entity which is often seen in the third world countries because of unregulated use of corticosteroids. Steroids are used therapeutically for various conditions, ranging from asthma to rheumatoid arthritis to other conditions, for instance, connective tissue diseases. But unregulated use of steroids is very common, especially for various ailments which may be as trivial as just joint pains or aches and pains or just feeling under the weather. I have today a case, unfortunately, a very interesting case of a young boy who was given steroids for a totally trivial condition, and then he was actually kept on the steroids for a long time. This led to the development of Cushing's syndrome, and subsequently he had different complications of Cushing's syndrome. Owing to the youth, he did not have any severe cardiovascular illnesses or diabetes so far, but nevertheless, he continued to have that. He was thoroughly investigated, and no reason was found. It was thought that perhaps because of the iatrogenic use of steroids, which apparently had been stopped, his adrenal glands were continuously suppressed, and that he was producing excessive amount of ACTH, and so therefore this was an ACTH dependent Cushing syndrome caused by the iatrogenic version, and that he would he would remit, but in the passage of time, perhaps sometimes from 1.5 to 2 years. But today, after taking another brief history, it's revealed that he, in fact, is still taking the steroids, and he's taking dexamethasone about 40 milligrams twice in a week, and his Cushing syndrome remains aggressive. So I'm going to show you the young gentleman who's got all the signs and symptoms of Cushing disease. He's got stria, he's got a typical abdominal shape, and he's got thin legs, and then he's got numerous furunculosis, and he's got a typical Cushing's facies. And the most important thing, as I've said, which was revealed in the history, was that he continues to take dexamethasone. Now, because he's taking dexamethasone, the investigations which I've carried out show a low ACTH and a low cortisol level, and this is an important learning point. So, whenever you get somebody who's got Cushing's syndrome, and you think that they may have an underlying cause, for instance, something wrong with the adrenal or something wrong with the pituitary gland, what we call as a Cushing's disease, you must always check the ACTH as well as the cortisol level. If the cortisol is low and the ACTH is low, the likely possibility is that there is an iatrogenic source, somebody is taking steroids from outside. In those cases in which you've got ACTH dependent Cushing syndrome, you'll have a high level of ACTH, and likewise you'll get a high level of cortisol as well, because that's an endogenous one. So it's the body. So when we check the cortisol level, it does not check the iatrogenic. That means it does not check the dexamethasone, it does not check the prednisolone, which we give, because they're not measured when you do a cortisol level. So the cortisol, if that is suppressed, and the ACTH level, whether or not you check it or not, if the cortisol level is suppressed and the patient has got Cushing's syndrome, remember this is an iatrogenic cause of Cushing syndrome. Now, the way to manage him is, because every time we aim to stop, because as I said, I mean, we weren't really aware that he was taking dexamethasone. Every time we try to prevent intake of dexamethasone or steroids, he just goes down. He becomes hypoglycemic, he becomes hypotensive, he becomes fatigued. So unfortunately, then he has to take dexamethasone. So the way to handle this is, the adrenal gland is totally suppressed. It's a non-functional adrenal gland, and we have to give him oral steroids. Oral steroids in quantity are less than the IV steroids. So then gradually he's going to, first of all, the oral steroids are going to be tapered up to a level at which he does not have any symptoms, and then they're going to be tapered down. So I'm going to start him at a level of 15 milligrams of oral prednisolone, which may probably be insufficient. He may probably require more than that. And then once he's stable on that dose, then the dose will gradually be reduced, and then the adrenal gland will be seen whether or not it resumes its function. Thank you.